Did you know that a baby's tongue needs to do lots of different things to be able to transfer milk well? It's not as simple as just being able to extend a baby's tongue. So they do need to be able to extend their tongue. But let's go through a few of the other things that are necessary. So it's a complicated set of maneuvers, actually, that babies need to master. One is certainly getting your tongue out further is important, and it is important that babies get that tongue over the gum. That prevents biting and chomping and other things that are not very effective with getting milk out. And the next thing is lifting the tongue. So it is very important for babies to be able to lift the tongue. So when you see your baby perhaps crying and the tongue is always like at the bottom of the baby's mouth, never seems to be reaching the top of the mouth, or if the baby's at rest, you can tell that the tongue is never resting on the roof of the mouth. That may be a problem if your baby cannot lift the tongue. Next, the baby needs to be able to kind of curl the tongue around the nipple. So that's an important point. If the tongue is just staying rather straight or being pulled down, then it's really not able to cup and kind of fit the nipple the way it needs to. And then possibly most importantly is this wave that the tongue needs to do to pull milk from the breast towards the baby. So sometimes babies just move the tongue in and out. It's almost like sandpaper on the nipple, or babies just go up and down, which is not effective either and can potentially be painful, especially if they're not extending and they're kind of chomping. But babies need to have this wave that pulls the milk their way. Now, sometimes babies do have a wave, but it's almost a wave in the opposite direction, and that almost pushes the nipple out of their mouth and is not effective. So babies can have 3 out of the 4 and really have problems, or babies can have 3 out of the 4 and be doing fine. So we have to put the whole picture together. What do they seem to be able to do with their tongues? How are they actually doing at the breast? Is there pain? Is the baby gaining weight? Do we document a good amount of milk transfer in a decent amount of time, or a small amount of milk transfer? That's how we gauge whether or not that tongue is functioning well, and whether or not there's anything that we might need to do to help to get the baby to use their tongue better, to be a better milk transferer at the breast. So a lot of things go into this, and then the first step may not be getting a tongue tie released. It really depends on your situation, and I'm not going to go into all the details of that, but I just wanted you to understand the mechanics that are going on, and that it is a complicated thing, and sometimes babies just need a little bit of time to practice, and then they figure it out. So be patient, especially if your baby is very, very new. They still may figure it out, but if you worry that your baby is not quite using their tongue correctly, please reach out to a professional, a lactation consultant, or if you want a second opinion from a physician who knows a little bit of a thing or two about breastfeeding, try to find a breastfeeding and lactation medicine physician. I am one in the Chicagoland area, and I can also see babies and moms throughout all of Illinois. So you can find me at intouchpediatrics.com. Don't hesitate to reach out if you are having any problems, and have a great day.